Hi, my name is Maria Valdez, and this is the lab results for Lab 4. It's June 1st, 2020, Bio 225 Microbiology. So my results, at least for Lab 4, was a lot of working with the microscope and really getting to know how to like move the little knobs in order to get like a focus on the microscopes that we were given, which were the slides. I really quite enjoyed it. I haven't used a microscope for like the past, I'm gonna say maybe 2 to 3 years. And just having one and actually like, you know, seeing the slides and focusing on the cells of the slides was actually pretty interesting, and I really enjoyed it. But besides that, doing the lab, which was the scraping of the teeth and the gums in order to see the plaque, and then the cheek in order to see, the cells. I found that to be very interesting. My experience, I believe, was very successful. I don't think it was a very difficult lab to do. It was quite fast. I'm gonna say maybe like maybe 6 to 10 minutes tops on what I spend, and then also looking into it through the microscope. I found it very interesting to see the cells of the plaque and also of the cheek. I guess I would expect these types of what does it explain how much experience are to real life? I guess if this would apply to real life in the sense that I would expect dentists to use these. I guess in regards to the plaque, to look in through a microscope, probably to see how they can take action in regards to like maybe there's some sort of infection in the gums that practically makes it clear that there's probably an infection, so therefore they can move forward into creating a plan of care for the patient who they're currently, of course, trying to help. So I guess I would say that would be used in everyday life for that. For the cheek swabs, if I'm not mistaken, can probably be used as a form of like DNA. Checking to see like form of like DNA results. I think like I guess in like paternity tests, and just to make sure that whenever that happens with people who want to find out if their children are their children, they do a lot of swab tests. So I guess say that would be something for in real life. During the experiment, like I said, I don't think I had a lot of issues. I think it was quite easy. It was minimal steps to make sure I did the lab. No, I don't. I mean, honestly, at the top of my head, I think I did pretty good. Yeah, not that I can think of that I feel like, oh, I messed up, I should have done this, because of the fact that I had already practiced with the slides, which gave me a better understanding on how to maneuver the microscope. Like again, so I felt very confident in that, and the whole scraping and smudging it on the slide. I think again was quite easy. But yeah, so that's my video for lab 4 of the results. Thank you.